All right, hello and welcome back. This is the second part of our talk on AI in clinical imaging. If you have not seen the first part, I highly recommend that you do. Otherwise, we are going to proceed. So, what we did in the first part is we kind of defined the uses of artificial intelligence in the current setting in clinical imaging. And we talked about the first and probably most widespread and widely used approach to artificial intelligence applications in clinical imaging. And that, of course, would be image analysis. So, that we discussed in fairly great detail in the previous video, but there's a few other ones that I really want you to be aware of. And we're going to start with the workflow enhancements. Now, when we talk about workflow, and maybe I should just take a quick sidestep and define workflow for you guys. It's actually not all that complicated to grasp the concept. It's fairly simplistic. It's a different story when you start to build it. But ultimately, workflow is a series of events that one needs to do in order to get a task done. So, for example, if I was to take an X-ray, my workflow would be to pick up the requisition, read the requisition, call the patient, bring him into the room, position the patient, set the factors, press the exposure button, make sure my images are diagnostic, and so on and so forth. So each step that I'm describing that can be considered a part of the workflow. So, and every healthcare professional would have their own, and certainly I think this will come as no surprise that radiologists are certainly no exception to that. So the idea is that at current, we try to automate workflows as much as possible. The less manual steps you have to do, the better your workflow is, the more sophisticated it is, the more automated it is. And that means that those little mundane tasks are done automatically, and that means that you can get more stuff done. Now, the problem is that we're facing right now that right now, when you build a workflow, you generally use something that's known as workflow rules. Now, there are preset rules when you say, if this happens, then do that. And there's different formats to them, but ultimately that's what they are. And you can usually put in a number of different variables, and you should, because life is quite complex. But the problem is that you still will not account for 100% of situations in most cases, unless you have a fairly simplistic practice. Well, the idea is that in order to overcome those limitations of those rules, and the problem with those limitations is that they're very solid. They're set in stone kind of idea up until you go in and change them. Well, what you can do is you can have artificial intelligence go in and analyze things and recognize that, it's not just from going from A to B. You may have to have a stopover at C or whatever the case is. So that's kind of the idea there, right? Now, yeah, workflow is definitely a critical piece in the successful operation of a healthcare enterprise. And to that, we say not just imaging, right? And that's where, once again, workflow improvements governed by artificial intelligence can really shine, because you can talk about this being expanded to way beyond just imaging. And we shouldn't think about it from just imaging standpoint, right? Because as far as a patient is concerned, it's never just imaging. It's never just surgery. It's never just, anything else. It's never just being seen by a specialist. It's all of those things cumulatively being done in order for the patient to get better ultimately, right? So once again, workflow improvements are quite significant. Now, we need to consider another thing. In the previous video, we talked about triaging, and that can be considered a workflow enhancement. But I am talking about slightly more immersed into the world of workflow, if you will. So we're talking about which is the next most or next best, most available specialist that we can find to read one or another study. How can we route the study best? How can we ensure that it ends up on the correct list? How can we ensure that the study progresses through the diagnostic ladder? And again, this can be a very large conversation, but basically all that stuff that the workflow engine is doing in the background for us If we can add some smarts to the operation of that workflow engine, we would likely see a significant improvement in the outcomes. And the last point that I'm trying to make here is that we're just looking at the very infancy stage of artificial intelligence algorithms being used in workflow. I imagine and I feel that this is something that is going to expand exponentially, and something that we will see more and more in the coming releases of various iterations of PACS systems, advanced viz, and things of that nature. But already now we are starting to see some very viable algorithms. For instance, there is a company that has come up with a way to rewrite something that's known as series descriptions in order to facilitate the use of, again, something that's known as hanging protocols. I will probably do a separate video on that so that we can better understand what we're talking about. But for now, we can not just look at images, we can also better the background. And actually, I think that AI will be absolutely amazing at that. Predictive analytics. Now, this is a really interesting concept. And if we were to actually look for the definition of predictive analytics, and I'm just going to read this out to you. It's practice of using data, statistical algorithms, and machine learning techniques to analyze current and historical data in order to make predictions about future events or trends. Whoa. All right. So what does that mean? Well, it's actually fairly simple, again, to grasp the concept. And as most things that we are discussing here, it's easy to describe, not so easy to implement. Basically, you have a large amounts of data. Um, when you look at that data from statistical standpoint, from the standpoint of mathematical analysis, you can actually make predictions. This is something that mathematics has allowed us to do for quite a while. We can, and extrapolate this on the future. Um, there are very many uses for this technology. I think that one of the primary ones would probably be within the realm of workflow. But again, once you have enough data, and once you have the right approach towards what it is that you're looking to predict, you can actually really improve your future outcomes. But just to give you an example, let's say you're staffing your hospital, clinic, and you have different areas that you need to staff. Well, predictive analytics algorithms can look at it and say, okay, so in your angio department, we've historically had low patient volume on Wednesdays, for example, and we see that we're staffing at by an extra person that we could use somewhere else, right? So something like that, we can say, all right, so we know that historically we have had certain amounts of patients, and we'll look at um, various other things that are available to it as far as data is concerned, and then make that scientific prediction, if you will, of what will happen. And that is certainly a lot better than just simply saying, we're going to have 3 people in X-ray, 4 people in angio, and 5 people in CT, for example, and that's it, right? Based on, well, nothing specific. That's as it relates to this particular week. Yeah, another tool for workflow enhancement, but we'll probably see it expand quite a bit more. So that's your predictive analytics. Decision support. Now, decision support is, again, fairly simple concept to grasp. As a physician analyzes various aspects of data associated with the patient, so whether this is imaging, whether this is, charting, whether this is, some kind of information they get from other sources, they need to keep in their mind a very large amount of data. And it's easy to overlook something. It's easy to forget something. And so in order to combat this, you can have an AI assistant that can analyze all that incoming data and give them the best sort of available option, give them some kind of a suggestion that they can work with. And then obviously the doctor would be the ultimate authority in deciding whether or not to use what AI has suggested. This is actually very similar to what we would see with image analysis, with my example of emergency medicine, for example. Now, another thing that we need to keep in mind is that apart from the fact that it was complicated to begin with, things change on an ongoing basis. There's all sorts of new research going on, your protocols change, your recommendations change, and things of that nature. So doctors don't always have the ability to go to all the latest symposiums or all the latest conferences. I mean, they try what they can, but they kind of have to concentrate on what they do primarily, and that's treating their patients. And so again, having your AI algorithm as an assistant who can say, well, we have a new protocol, we have this available, is once again a very useful thing. And just to kind of give you an idea of, because one may ask, well, is there a real problem? And the answer is yes, there is. So this is an extract from a study that was done some time ago, and they looked at diagnostic errors in the United States and other medical errors too. And they looked at it from the standpoint of malpractice claims, which is quite widespread in the United States, maybe less common here in Canada where I'm at, but nonetheless, it's given us very solid data here. What they found is that diagnostic errors rank high in the cause of death in the United States, and they're more common than any other error. So they ultimately what they're saying here is that they've looked at errors that have been very critical, that have caused death of the patient, unfortunately, and in turn, that has initiated a malpractice claim in the court of law. And the most frequent error that has been done was actually the diagnostic error. And then they go on to say that most of these errors are related to cognitive errors. What does that mean? Well, that means that we as humans are only able to do so much. And working with large amounts of data, we are prone to errors. We will err at some point. And so having that second shield, if you will, having that second layer of protection from those errors is certainly a good thing. And that, in essence, is decision support, where you come in, you open your patient, whether you open it in imaging or whether you're a physician just, opening up your electronic medical record and having a virtual assistant that can say, I've analyzed all the information that we have about this patient. This is what I've come up with. Those are the ideas that I can suggest to you, and then you ultimately can make the final decision as the most responsible physician. And then last avenue that I wanted to discuss is native images enhancement. Um, what is native images? Native images, here I'm referring to images that have come off of the modality. So images that were acquired by the CT scanner, images that were acquired by an X-ray machine or something of that nature. And what happens is that, well, if you talk to any technologist, they'll know that one way or another you end up with suboptimal images sometimes. It's not always your fault, sometimes it is. Um, Generally speaking, we're talking about noise. That's not the only thing that can happen. You can have motion, you can have artifact, you have lots of things, but noise is a very common thing. Noise usually means that you can't see things very well because, well, there's a lot of noise on the image. And that oftentimes is caused by suboptimal radiation exposure or suboptimal time that the patient was in the scanner or something of that nature. Now, the thing is that if we were able to take those suboptimal images and enhance them using AI and then make them diagnostic, that would, for one, allow us to improve on the images that we have acquired with some kind of suboptimal factors and error, but that also opens the door for implementation of programs where we purposely use lower dose than what we would want, or we keep the patient in the scanner for less time, in case of MRI, for example, than you normally would, which would make a significant difference to the patient, right? From the standpoint of us giving the patient less radiation, obvious, right? Don't think I need to explain that. With MR, a lot of people are claustrophobic. They would not need to stay in there for as long. We may not need to medicate them. So all sorts of advantages. But of course, it's not as simple as taking your picture and running it through Google, for example, having it enhance it. Simply because, well, somebody's life relies on these images. So needless to say, this is a good thing, something that we can really benefit our patient population from. And the last thing that I wanted to mention on this topic is that you can do this at the scanner level, or you can do it at the workstation level, so at the level of PACS. And both are used. Sometimes you would use both. At the scanner level, this is more of a kind of embedded various reconstructions. All sorts of reconstructions exist, whether you are minimizing the effects of metal in case of CT scanning, or whether you're trying to improve the image quality with low dose used. Quite a lot of vendors, in fact, most vendors would have one or another approach towards using that type of artificial intelligence through those avenues. And then, of course, we can do it post factum too. Again, it really differs because we're talking in generalities. We kind of have to cover all bases. But then if we were to look at this in more specifics, once again, you'd see that any one of these ones is a big, huge world. All right, so let's get to the main question of our video. Will it replace doctors? And yeah, the answer is not quite yet, as you can see on your screen. So here's the idea. We kind of discussed this already, but just to reiterate this. AI does what it's trained to do, and it does so with incredible accuracy and incredible efficacy. But unfortunately, it only does that and nothing else. So if I was to give you an example, and don't read too far into it, it's just me trying to illustrate a point. Most modern vehicles are equipped with radars, right? And we can do different things with them, but a common thing to use them for would be blind spot detection, right? So one could argue that, if you have a well-installed radar system, your radar blind spot detection might actually work better than you. It will work consistently. It will not forget to do it. It will remind you to, that there might be a vehicle, in your blind spot and you shouldn't change your lanes. So one could argue that a blind spot detector will work much better than a human would. But will it replace a driver? Well, of course not, right? And the reason why it wouldn't is obvious. A driver doesn't just check blind spot and then goes about their business, right? A driver has to do a whole bunch of things as they're out on the road in order to make sure that they get from point A to point B safely. And that's the same kind of idea when we talk about imaging and a physician reading something. It's not just finding one single thing and be done with it. There's quite a bit more that needs to be considered in order for the full-blown diagnostics to occur. So that's kind of where we're at. Now, I don't want to tell you what's going to happen in the future. I don't think anyone knows. And yeah, everything's possible. But at the moment, AI is not a threat to physicians. Quite to the contrary, AI is a magnificent tool that can improve the productivity of physicians, that can improve their work-life balance, and ultimately, it will improve the care for the patients and the outcomes too. I'm very certain of that. All right, I thank you very much for watching this. Stay tuned for the next video as it will be coming up. Take care now.